Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Welcome back to the Radiology Review podcast. On this episode, I will focus on ultrasound physics, and we will talk about common ultrasound artifacts in a question and answer format, and along the way, we will cover some fundamental principles of ultrasound physics. As a reminder, I am making study guides available for nearly all episodes on my website, theradiologyreview.com. So if you haven't seen those yet, feel free to go to my website and download your free study guide. I have recently made study guides available for the previous episodes on liver masses and interventional radiology liver-directed therapy. I will also place the study guide for ultrasound artifacts on my website when this episode is released. Thank you again for the feedback. I take your constructive comments into consideration in every detail. Thank you also for those who have written me to suggest topics for episodes. I will do my best to cover all of the suggested episodes in due time. Without further ado, let's get into this episode. First question. What is the cause of reverberation artifact on ultrasound? One more time. What is the cause of reverberation artifact? The cause of reverberation artifact is having two echogenic structures, which are in close proximity, that cause the sound wave from the ultrasound transducer to bounce back and forth between the echogenic structures. As the sound wave bounces between the echogenic structures, this causes artifactual signal in which the length between each reverberation is equal throughout the visualized image. One way I remember this is I think of two echogenic structures that are at a fixed position from one another, and then I imagine that if a sound wave was passing between these echogenic structures, which are at fixed length, I would receive a uniform signal back at the transducer. Therefore, you see an equal length between each line within the reverberation artifact. That brings us to the next question. What is Comet tail artifact, and can you name a few anatomic structures or physiologic substances that commonly show comet tail artifact? I'll give you a few more seconds to think about comet tail artifact and what causes it. Comet tail artifact is a type of reverberation artifact, which we just discussed, that occurs within substances such as cholesterol that can be seen with adenomyomatosis of the gallbladder wall, or colloid, such as in a colloid cyst within the thyroid. With comet tail artifact, you see one continuous line posterior to the gallbladder wall, in the case of cholesterol in the wall from adenomyomatosis, or posterior to the colloid cyst in the thyroid. And this line is continuous instead of the multiple separate lines that you would see with classic reverberation artifact. In comet tail artifact, the individual reverberations are not resolved as multiple separate lines. Make sure to look this up if you do not know what it looks like. Comet tail artifact. Next question, what is ring down artifact? Think about that for a few seconds. Ring down artifact commonly happens in water with air bubbles. I think that is key. Ring down artifact, you should automatically think air bubbles within water. And ring down artifact results from the sound waves resonating between the air bubbles. This is a form of comet tail artifact, but it results from air bubbles in fluid rather than reverberation in cholesterol or colloid as in comet tail artifact. Unlike comet tail artifact, you will usually see actual reflections in the beam that are in a variable pattern. This is different from reverberation artifact, where the reverberated waves manifest as multiple lines that are equal in distance, and this is also different from comet tail artifact, where the lines cannot be separated. I intentionally presented these three questions in order: reverberation artifact, comet tail artifact, and ring down artifact, because they are easy to confuse. Key for comet tail artifact is that these are related to cholesterol or colloid most classically. With comet tail artifacts, you cannot resolve individual lines within the tail of the artifact. Ring down artifact is classic for air bubbles within water. Classic reverberation artifact between two echogenic structures will show you lines that are of equal length posterior to the substance causing the artifact. Next question. What is mirror image artifact, and what is a classic cause of this? The answer is that mirror image artifact results from a double reflection. This commonly may result from a double reflection of the sound waves between the diaphragm with air above it and liver beneath it. The most common practice question for mirror image artifact that I have encountered is showing you a portion of the liver, perhaps a liver cyst or an echogenic liver mass that you see on both sides of the diaphragm. And they would expect you to know that this is mirror image artifact, and they would expect you to know a deeper layer question that if you lose the air on the lung side of the diaphragm, such as with a pleural effusion, you would no longer see the mirror image artifact, because the cause of mirror image artifact is a double reflection of the sound waves between the diaphragm with air above it, so not water above it, but you need air above the diaphragm, and liver beneath it, and as a result it can give you the false appearance that the liver or structures within the liver are on both sides of the diaphragm. Therefore, by extension, if you see mirror image artifact, that means there is no pleural effusion in that region. So this artifact could actually be used at times when you are evaluating for pleural effusion to help confirm that no pleural effusion is present. Next question. This one is really important and gets at fundamental ultrasound physics. What is the assumed speed in meters per second that an ultrasound machine assumes a sound wave will travel through tissue? What is the propagation speed of ultrasound? That is another way to ask the same question. So the propagation speed is the speed of sound through tissue that the ultrasound machine assumes is constant. The assumed speed at which ultrasound beams pass through tissues, which is also known as the propagation speed, is 1,540 meters per second, 1,540 meters per second. That is the classic speed of sound value by which most diagnostic ultrasound machines reconstruct their image, and we'll talk a little bit more about why that number was chosen shortly. But for now, drill into your mind 1,540 meters per second. Also remember the unit meters per second. Next, what are some factors that influence how fast ultrasound waves will propagate through tissue? What are some factors that influence how fast an ultrasound wave will propagate through tissue? A major factor I would remember is that tissue density greatly influences how fast an ultrasound wave will propagate through tissue. Tissue elasticity also is a major factor of the speed of ultrasound through tissue. So the two major factors I want you to keep in mind in terms of what influences how fast ultrasound waves propagate through tissue are first, tissue density, and second, tissue elasticity. Next question, true or false? As tissue density decreases, the speed of ultrasound propagation through tissue increases. Is that true or false? As tissue density decreases, the speed of ultrasound propagation through the tissue increases. This is false. As tissue density increases, propagation speed of ultrasound also increases. So sound waves pass more quickly through dense tissue. For example, the speed of ultrasound waves through bone is about 4,080 meters per second, whereas the speed of ultrasound waves through air is only about 330 meters per second. That is more than a tenfold difference. Bone at 4,080 meters per second and air at 330 meters per second. The speed of ultrasound waves through tissues like fat, water, blood, Muscle and solid organs like the kidneys and liver very much less, as the densities of these substances are more similar than bone compared to air. And if you look it up, the range of ultrasound waves through these tissues is about 1,450 to up to about 1,580 meters per second. That is only a range of 130 meters per second difference. Therefore, 1,540 meters per second, which is that key number I told you to memorize for the propagation speed, 1,540 meters per second is in the range I just mentioned for tissues like fat, water, blood, muscle, and solid organs. So essentially that 1,540 meter per second value is an average of common soft tissues, and because it is an average representative value, you can use this to resolve images of tissues that are commonly encountered in the human body, with the exception of air and bone, which can cause artifacts when you are predominantly imaging each of those. Next question. What is the name of the major artifact that occurs when ultrasound waves pass through tissues that have different intrinsic propagation speeds? When ultrasound waves pass through tissues that have different intrinsic propagation speeds, this can cause speed displacement artifact, which is the name of the major artifact I was looking for. Speed displacement artifact. Speed displacement artifact results because the ultrasound machine will assume the sound waves are traveling at 1,540 meters per second, whereas the ultrasound beam may have actually been traveling at 330 meters per second. For example, if one was imaging through air in the lungs or imaging through the liver when there is hepatic steatosis that is surrounded by focal fatty sparing. Speed displacement artifact will display a structure or a portion of a structure at an incorrect depth. And the reason the ultrasound may display the structure at the incorrect depth is that the ultrasound machine is assuming that the sound wave traveled out and returned back to the transducer at 1,540 meters per second, when in fact the actual speed through the tissue may have differed. Therefore, the ultrasound may misattribute the depth of the structure, and this is speed displacement artifact. Next question. What is refraction artifact? That is REFRACTION, refraction artifact on ultrasound, and how might this be shown on images? Refraction artifact results when imaging through structures which first refract the beam and then reflect the beam, which causes the ultrasound system to believe an object is directly in front of the probe, when in fact the beam was refracted and subsequently reflected back to the probe by another structure. Basically, the way I think about this is the ultrasound wave leaves the transducer, enters the body, hits an object which refracts the beam, and then by chance that refracted beam hits another object that then reflects it back to the ultrasound transducer. When you think about this pathway of the ultrasound beam entering the body, getting refracted, and then by luck being reflected back to the probe, it is not surprising that the ultrasound system would show that refracted and subsequently reflected beam to be in a false position from reality. Interestingly, a few common scenarios that could be tested are seeing multiple gestational sacs on ultrasound imaging that is obtained when the ultrasound beam passes through muscle, or seeing multiple aortas when imaging the abdominal aorta through the rectus abdominis musculature, when in reality there is only a single gestational sac and a single aorta. So obviously it can be very important to know if refraction artifact is at play, because you don't want to mistakenly tell a woman that she has 2 gestational sacs when in fact there is only 1. So the key is that you only would see these multiple structures when imaging in a single plane. So to confirm whether there is aortic duplication or to confirm whether there is a twin gestation, you would image in different planes on ultrasound, which would then reveal that there is only a single gestational sac, a single aorta, or a single of whatever else may have been refracted and subsequently reflected. And you rely on imaging in multiple planes to show you what is artifact versus an actual surprise finding. This certainly is not the only reason, but perhaps it is one reason that we should always image structures of interest in two planes, whether radial, antiradial, or longitudinal and transverse. And this is a basic description of refraction artifact. I personally think this is one of the ultrasound artifacts that is a little harder to conceptualize. So if this is something you have not encountered before, and especially if this is something that is still unclear to you, please spend some time and read more about refraction artifact. That is enough for now. I will continue this discussion on ultrasound artifacts on the next episode. Please remember to go to my website, www.theradiologyreview.com, to download your free study guide on ultrasound artifacts that I will make available after I publish the next episode. My intention is to continue to produce and release these episodes at no cost to residents, and that way this material is freely accessible to all of you in the United States and throughout the world who are simply trying to learn or refresh your radiology knowledge. Because I know this material has been of value to some of you, making these episodes is meaningful to me, and I appreciate each listener that listens to this podcast. And my desire to help you prepare for the board exams is sincere. That is why I stay up late at night to record these episodes, and I often wake up early in the morning to edit these podcast episodes, because I believe this is important. And if you find value in these podcast episodes, I encourage you to share with other residents. My goal is to reach as many residents and as many radiology learners as are interested and as could benefit from this type of educational content. Thank you for listening. Continue studying, prepare to succeed, and I will catch you on the next episode. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.